Hi there, my name is Rory Wilson. I'm a junior doctor working in the NHS in Scotland. I've been lucky enough to be able to present some research that I did at Imperial College London within the Department of Infectious Disease Epidemiology. So our project was looking at ecosystem associated diseases, and specifically, as we all know, there's increasing evidence linking the emergence of these diseases to the accelerating anthropogenic and environmental changes that are undergoing. But the fact is we still don't know much about the generality of these patterns amongst the ecosystem-associated diseases. And the second issue that we wanted to look into was that many of these diseases are very neglected, and we wanted to gain understanding of the current levels of global health research into their global health impacts. So essentially in this project we did a rapid review to try and identify what we felt were the most important ecosystem associated diseases globally. And once we'd identified them, the next step was to sort of conduct a literature review to assess the current responses to global changes at quite a fundamental level. So looking at climate change, forest fragmentation, what are the drivers for each of these diseases. And the second objective was critically examining our ability to understand their potential future health impact on global health. So that's a little bit wordy, but essentially we wanted to look at the current global health impact of these diseases, which isn't great. So we were trying to collect global information on morbidity, mortality and their burden, which proved quite difficult because there's not much research into these diseases. And then we were assessing what is the capacity to treat these diseases. For example, are there specific treatments or vaccines? So the idea was that we're able to see which diseases are being quite driven by anthropogenic changes in the future, and by understanding our current capacity to treat these diseases or lack of capacity to treat these diseases, we're creating sort of almost a short list for future threats that there needs to be some sort of research priority to, from both research into their spread with these changes, but also more of a priority on this drug development and vaccine development. So it's a really interesting project, and I'll be happy to answer any questions. Get in touch with me by email, and I hope you enjoy the conference.